Hello everyone, my name is NANDA ERLINA from class TBID, and for the next several minutes I shall be talking to you about dealing with anxiety. I have divided my presentation into 3 points. A. What is anxiety and what's the cause? B. What are the signs of anxiety? And C. How to dealing with anxiety. Now let's go to the point A. Anxiety is excessive worrying about everyday events and activities which the person finds difficult to control it. This condition will disturb the daily activities of the sufferer. Worrying about something is a reasonable thing, especially if there is certain pressure or condition. But if worrying is becoming uncontrollable, excessive, even disturb your activities, this can be a sign you are suffer anxiety. And what's the cause of anxiety? Until now, it is not known the exact cause of anxiety, but there are some factors that are thought to cause anxiety. The first is have a history of trauma or have experienced events which cause stress, such as bullying. The second, have families with anxiety history. The third, have a history of using drugs or liquor. And the last, have a history of disorders of nervous system. So that's all for point A. Now let's turn to point B. What are the signs of anxiety? If you suffer anxiety, there are some signs. The first is excessive worrying about something that lasts minimally 6 months. The second, feeling uncontrolled worrying. The third, being easily tired. The fourth, having difficulty concentrating. And the fifth, having difficulty falling asleep or having restless. Now we go to the last point. How to deal with anxiety? There are 2 ways to dealing with anxiety. The first is therapy. CBT or cognitive behavioral therapy. This therapy helps the patients in order not to be negative thinking, and the patients will be helped by psychiatrists or psychologists. And the second is medicines. There are some type of medicines which usually given to handle anxiety. There are antidepressants, pregabalin, and benzodiazepine. Okay, that's my presentation. Before I finish, let me just summarize the main points. Anxiety is condition where someone feels uncontrolled worrying about something and it is difficult to control. The cause of anxiety are traumatic experiences or having a history of anxiety from family. If someone suffers anxiety, they will feel uncontrolled worrying and difficult to do activities. And there are 2 ways to dealing with anxiety. The first is by therapy or consuming medicines. Okay, that's my presentation. Thank you for watching this video. Thank you for your attention and goodbye.